In January, a federal judge gave final sign-off to the settlement agreement in a class action lawsuit, which directs state health officials to change how they deliver Medicaid-funded mental health and substance use services for kids in New York. Part of the agreement requires the state to convene an advisory committee to make recommendations on the implementation of the settlement, but members of the Implementation Advisory Committee wrote to the Hochul administration in July to express their concerns with how the state is engaging stakeholders, arguing that at a June meeting, it felt like they were supposed to rubber stamp ideas being cooked up internally by state officials. For more on the implementation of this settlement, we're joined on the Capitol Press Room by Bill Gettman, a member of the advisory committee and CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping 18,000 kids and adults navigate abuse, mental health needs, and a range of other demands. Welcome back to the show, Bill.
Great to see you, David.
So before we get into the implementation of this settlement and the concerns that you have to date, let's talk about what prompted this lawsuit in the first place. What is it about the delivery of behavioral health services to kids on Medicaid that was lacking?
So you have to go back in time a little bit. I have done 2 redesigns of children's mental health. It's going back to the Pataki administration. Under that administration and later Spitzer, the Bridges to Health program was set up to provide services to about 3,000 kids and their families who had mental health concerns. That program was replaced later by Andrew Cuomo and his administration to create a broader system of care for kids with mental health needs. It has not worked, and that's what I think the court recognized and the plaintiffs recognize. There is underfunding, there are gaps in services, there are wait lists across the state, and then in addition, there's whole areas of the state that have no access to service, rural areas, the North Country, the Southern Tier, and others. The system is broken, and I think the federal court and the state, to their credit, realize we need to redesign and rebuild the system quickly and through the lens of children and families' experiences.
And we've heard testimony from the state mental health commissioner, Dr. Ann Sullivan, about the timeline for this. And they've talked about 18 months of planning from stakeholders and that they've got funding for that. And they're going to hopefully design something over the next 2 to 3 years after that. Based on that timeline, where should we be in the overhaul process, and where do you think we are right now?
So the settlement is a 47-page single-spaced document that details all the requirements around eligibility, about funding, about workforce, about data collection, about quality management, and a focus on outcomes. We are now 6.5 months into the 18-month process, and we haven't come up with a new design or a new structure. A year from today, we have to have a new system that has to be approved by the plaintiffs and the court. We are behind. The work is enormous to rebuild this system. And I think the work of the advisory committee, everyone's ready to roll up their sleeves to do the work. But this is a monumental task, and we can't diddle.
Well, the letter that was sent to the State Office of Mental Health and the State Department of Health in early July outlined some concerns that several members of the implementation committee, including yourself, have. And the first one I want to highlight stems from the experience of a June meeting of the IAC, where it talks about basically getting a list of ideas or plans and being asked to sort of weigh in on them. What was the problem with that, and how do you think this process should go if that's not the way?
And I think given the enormity of the task and the amount of work that has to be done, there needs to be a detailed work plan with each task delineated. Who's going to do what? Who's going to work it? I think we need to break into work groups and identify solutions for the state. Granted, this is the state's responsibility to redesign the system, but there are some 35 experts around the table, providers, members from local government, peers, who know what the problems are today and can offer constructive solutions to it. And I think at the June meeting, we were a little concerned that we were getting pieces of a potential solution without a conversation, without a problem statement, without a financing method. We don't even know, maybe the state does know, how many kids are going to be captured by the settlement and how many kids we need to plan for. I think it's important to have that kind of data and that scope so that we can talk about how many workers do we need? What does the financial contribution need to be? How do you get kids into services? There have been suggestions that we will use the current government operations at the county level to access services for families. They are woefully understaffed. So I think what came out of the meeting was a frustration that we got less than 12 months to get this right. And if we don't get it right, kids and families won't be served and we will still have a broken system.
Well, trying to give the state the benefit of the doubt here, you mentioned the idea of 36 experts needing to weigh in and the timeliness and scope of this work, which sounds like hurting a cat or, I don't know, rebuilding a airplane in midair, pick your poison. So is it possible that this is just the best way for them to go about this and that the advisory committee should be at the whim to just weigh in and that it's not practical for a committee like this to steer things?
I want to give the state credit because they're committed to doing this work. I think the limitation is the scope of what has to be accomplished. People on the ground know how services are currently delivered. We know where the gaps are. We know why programs are decertifying and reducing their access for families and kids. I think there has to be a dialogue to capture that information. The state is doing some listening tours this summer to get input from across the great state of New York. It's got to be accelerated. And I think the other point that many of us feel is, in the meantime, what are we going to do to prop up the system? The system is crashing across the state because there's not enough workers. The need is growing. So I think what we're going to have to do is go into the next budget cycle and put in transitional money, because this plan, even though it's due to be approved July of 27, I wouldn't want to bet in the Saratoga sense it's going to be approved. We need the federal government to weigh in. We need the state budget to enact money. We need a workforce that's available. And those are huge obstacles.
Well, another point that the letter from the advisory committee members makes is this idea that this situation calls for broad systemic change in response to broad systemic challenges, and that means not tinkering around the margins. It means not putting a new coat of paint on an old automobile and calling it a new one, which is what we often see with crises and how the state responds. Something like the Justice Center in many ways is just a same vehicle, just with a new name and a new mantra. So what do you think holistic change looks like in response to this issue?
I think we need to take the advice of the people in the field who have offered a lot of great suggestions. We need to recognize how many people need this care, and it's tens of thousands of individuals who need care statewide. We need to answer the hard question of how are we going to get a workforce to do this? We don't have enough workers now to do the work. How are we going to pay for it? Where do the managed care plans fit into the system? This is not rebuilding the plane while we're making it. This is about building a brand new plane, a new generation of flying apparatus, so to speak.
Well, before we move on, let me reintroduce you. For listeners just joining us, I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with Bill Gettman, CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping 18,000 kids and adults navigate abuse, mental health needs, and a range of other demands. When you think about this year's state budget, was there anything in this budget that reflects a investment in maybe the priorities or the values espoused in this settlement?
I think the state budget and a lot of the testimony, including ours, talked about the need of how do we build a bridge or transition from what we have today, however broken it may be, to the new system. No money was allocated for that. And then as we look at the implementation schedule, which is July of 27 at the earliest, how are we going to keep the system, propped up right now? And I think that's a real challenge and a missed opportunity. What scares many of us is that providers are going to look at the new system and say, I can't wait to 27. I need support from my workforce. I need more technology. I need simplified processes. I mean, the governor's effort to streamline assessments and to reduce the red tape, for instance, is a great opportunity here. And we need to bake that into the process also. And, I think the advisory committee wants to help in that regard, but we just haven't seen the broad plan yet.
Well, what do you see as the consequence of maintaining the status quo, so to speak, tinkering around the edges while maybe not really addressing the core problems, if that ultimately gets the approval of a judge in the Trump administration? What does that mean for the people who need services?
Nothing will change. If we're tinkering around the edges, we're going to have wait lists. We're going to have regions of the state that have no provider capacity. We're going to have families in crisis. We're going to see more kids going into the emergency rooms and being placed in psychiatric units or kept in inappropriate situations. I think we're going to see a lost generation.
And How much of this conversation and the work of the committee and its recommendations ultimately boils down to here's the dollar amount you need to invest, and how much of it is here's the different policy approach that we need to take?
I think we got to turn that around and say, what's the need? How many people are requiring services? And what's the new model going to look like that deals with workforce, access, sufficient reimbursement rates? And then do the math and say, okay, how do we pay for it? Is it federal money? Is it state money? Is it a combination? And we haven't done, according to what we've heard so far, we haven't done that calculation.
But I have to imagine you have an idea of whether we're talking millions or billions, for example.
I don't think it's $1 billion investment at this point, but I think it's millions of dollars to redo it. And the other concern is what's the pace for redoing it? If we start in some mid-27, is this going to be a multi-year rollout, which will be very difficult to transition to, or are we looking for a Big Bang theory? Again, Big Bang implementation. All these things have not been discussed, and maybe there's a plan out there, but again, a little transparency would be very helpful.
Have you heard anything back from state officials, either in the State Department of Health or Office of Mental Health, since this letter went out on July 2nd?
State agencies did respond and are trying to convene a call with us to talk about our concerns and a path forward.
And did they seem receptive to the ideas of the critiques you raised? Did they feel like they came out of nowhere? Is this one of those areas where the civil servants that are tasked with implementing this feel your pain and say, I'm with you, but you got to understand X, Y, Z? I mean, what's sort of the gist of it?
I think they understood the need for a conversation. They're under a lot of pressure to get this work done, and I think we need to level set expectations at a minimum.
And this is one of those situations where, as you pointed out, it's not just the state that's responding to this. There's federal need. So is the federal government stepping up in any way, shape, or form in this area? Or should we be asking more from our congressional representatives and, say, the White House?
Whatever plan, whatever implementation strategy is developed has to be approved by the HHS in Washington, the Trump administration. It's going to relate to waivers of rules. It's going to relate to funding, et cetera, et cetera. Your guess is as good as mine as what's the state's relationship with the Trump administration right now, but they're going to be a valuable player because they're going to have to put money out. So the question, it's really a strategy question, is how do we engage our congressional delegation around driving a solution?
And I imagine the pitch that you make is this is about kids and their mental health, and it's the poorest kids in some cases in the state.
Not only that, it's a it's a settlement to a lawsuit. We have a judge, we have plaintiffs in the situation that need to approve the implementation. We don't want to delay this out for decades. We want to get it right the first time.
Well, we've been speaking with Bill Gettman. He is the CEO of Northern Rivers Family of Services, and he is a member of the Implementation Advisory Committee tasked with making recommendations on the implementation of a class action lawsuit directing state health officials to change how they deliver Medicaid-funded mental health and substance use services for kids in New York. Bill, thanks so much for visiting us in the studio.
Appreciate the opportunity to talk about kids.
And for more Capitol Press Room coverage, including conversations with lawmakers and advocates, check out capitolpressroom.org or wherever you download your favorite podcasts. Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.